Directional terms are used to describe the position, orientation, and relative locations of various body parts and structures in relation to one another. These terms provide a standardized and universally understood way of communicating anatomical information. Dorsal refers to the surface closest to the backbone, or in the direction of the backbone. For example, the spine is dorsal to the stomach. Dorsal recumbency means that the patient is lying on their back. Ventral refers to the abdominal surface, or in the direction of the abdomen. For example, the stomach is ventral to the spine. Cranial refers to the skull, or towards the skull. For example, the heart is cranial to the rectum. Caudal refers to the tail or towards the tail. For example, the rectum is caudal to the lungs. Medial means closer to the midline or towards the midline. For example, the lungs are medial to the ribs. Lateral means further from the midline or away from the midline. For example, the hips are lateral to the bladder. Lateral recumbency means that the patient is lying on their side. Right lateral recumbency means that the patient is lying on their right side, and left lateral recumbency means that the patient is lying on their left side. Proximal is a term used in reference to the limbs and means closer to the body or in a direction towards the body. For example, the knee is proximal to the ankle. Distal is a term used in reference to the limbs and means further away from the body or in a direction away from the body. For example, the elbow is distal to the shoulder. Palmar refers to the underside of the front paw, the walking surface. For example, the grass seed is embedded on the left palmar surface. Plantar refers to the underside of the hind paw, the walking surface. For example, there is a laceration on the right plantar surface. Rostral is a term used solely for the head, and it means the parts of the head containing the muzzle, or toward the muzzle. For example, the lesion is rostral to the eyes. In relation to the head, caudal refers to the back of the head, skull.